Good afternoon. My name is Lee Ee Lin. So I'm here to talk about acupuncture. With the title, acupuncture is not just about needles. Okay. In this talk, I would like to present what acupuncture is, some history of it, and also to show that acupuncture is not what is taught stereotypically, where we just put the needles into places where it hurts. And I would like to introduce myself. So I graduated as a pharmacist. Pharmacy is my profession. And while I was involved in clinical research in phase one study, I started studying Chinese medicine, traditional Chinese medicine, and focusing on acupuncture. And since then, I have started practicing acupuncture about 9 years ago and have been operating my own acupuncture center 5 years ago. So compared to when I started practicing acupuncture, that was about 10 years ago, acupuncture now has been widely accepted throughout the world, from China, where it originates, to even America, where physicians have started using it to manage pain and to reduce painkillers, especially opioid usage. So what acupuncture really is about? Well, it's literally from the name acupuncture, it means to puncture with needles. But in Chinese language, 针灸 is not only using needles to stimulate the acupoints. You can also use other method. So the word "jiu" means to burn with moxa. And with the modern technology, there's a lot other methods. Okay, for example, acupressure, cupping, electric acupuncture, and laser acupuncture. These are the few ways we can use. So it's not only just needles. So I would like to start a little bit of history of acupuncture. So the first documentations of meridian was found in Mawangtui tomb, China. This tomb was sealed in 198 BCE. So this manuscript, it describes 11 meridian pathways as opposed to just 12 in the current acupuncture theory. So instead of mentioning acupoints, they just mention the areas of the pathway. There's no acupoints there yet, but they also describe some diseases due to meridians. And interesting enough, in this manuscript, needles are not used. Oxybustion is the main treatment method. And there are some new postulations of method theory just being shown by Shaw in year 2020, last year. This manuscript could be the first description of anatomy of the meridian lines. So we were both looking into it, postulations. But in the actual ones, there's been accepted throughout the acupuncture history. First documents that actually describes the meridian, acupoints, and also the diagnosis. And this is the one that mentions acupuncture treatment with needles. It's the Yellow Emperor's classic of internal medicine, Huang Di Neijing. So it dated from about 100 BCE, just about 100 years later than the Mawangtui. But this is the earliest classical textbook of acupuncture. And in this more than 2,000 years since, we have a lot of generations of Chinese physicians, generations of acupuncturists that developed the practice and codified them into various texts. So even until now. So just a little bit of pictures. The bone needles, it was found in Stone Age. Could be used for sewing, but I like to think be used for some basic acupuncture or bloodletting. And the needles found, this is much later in Ming Dynasty, just a couple of 100 years ago. Okay, and I'd like to talk something further, not in China. So this is the Ozyman, was a mummified remains found. He died in European Alps mountains, and his body was preserved in glacier. This is about 5,300 years ago. So in the research on his skin, they may indicate some kind of stimulatory treatment similar to acupuncture. As you can see, there's some tattoos on it, and they were found that these tattoos are places in the rib cage, spine, wrist, knee, calves, and ankles. We'll say this is not for decoration purpose, as they are all hidden. It's in the spine, behind the wrist and knees. So we postulate that this could be the places where you have most of pain. And the researchers had actually asked acupuncturists to locate the points where the tattoos is about. They are actually very near to the acupuncture lines, and so it's a hint of how acupuncture may not develop only in China and also in many places throughout the world. It's a very interesting thing about. Okay. So after the history, I would like to talk about some basic acupuncture theories. So the most important thing that acupuncturists we talk about is qi. So it means one of the basic components forming any parts of living. So the other two parts is jing, which is the organic components of the body, and shen, which is the mind component or psychological component. So qi itself is more of the energy part, the unseen part that moves the body, the invisible component. So this is the one that's not really been proven yet, but is one that we use in our practice of acupuncture. And in the theory, this qi circulates in the body along the meridian lines, so the pathway of the qi. So by inserting the needles and manipulating it, so we attempt to regulate and restore the balance of the inner body qi. It is something that acupuncture doesn't really mean that the needles itself treats the body. Rather, needles is like a switch to the body where needles manipulation of it stimulates the switch, and then the body starts to heal itself and to do all the functions necessary. So just talk a little bit about acupoints. In the actual classical acupoints along the meridian lines, there are 361 and connected with 12 by 12 main and 8 extra meridians. And there are some extra points and usher points. Usher points is more like the actual pain point in the body. They are not connected by meridians, but it's been found useful, so it's been considered as acupoints as well. And WHO has did a review and analysis of acupuncture that was in year 2003, and they have reviewed the control clinical trials, so on disease, symptoms, and conditions, and they do found some conditions mentioned that they are quite effective in treating it. So just a quick list out, and so it's a few: radiotherapy, chemotherapy, and a lot of them mentioned on in. These are effective treatment to it, and this one has been shown some, but it's not enough yet. A single clinical trial, but if we mention even palsy, cancer pain has been on, and also there is no only reporting some effects, but it's worth trying out because treatment by conventional and other therapies is difficult. For example, irritable colon syndrome and deafness, and these are the ones that specific, because in acupuncture, each acupuncturist has their specific modern on it. So these are more specified ones. So and also is the WHO review has concluded that acupuncture treatment is safe if performed correctly by a well-trained practitioner. And in my experience, the most common side effects is bleeding, stoma, which occurs about 5 to 10% of the needles, and is very mild and can be reduced if taken precautions beforehand and after. And some fainting, that is very, very rare. We can take a lot of precautions on it. And also acupuncture is non-toxic, minimal adverse reactions, and also it doesn't have any reactions with drugs. Okay. So that is what acupuncture is considered safe. So just talking about how acupuncture works, like how does acupoints or acupuncture points exert its effect. So there are 3 ways of it exerting its effect. So the firstly is locally. So this is where like poke where it pains. So we choose the points around problem area and we find the points and just put it in. And also I will go like regionally along the meridian lines, going up For example, you have sun, maybe up to the lower back, treat it. So this is like a remote treatment effect. And I also do have some specific acupoints, this special therapeutic effect. Like some points, through experience of the years, they found that these points are very effective to treat a particular condition. Sorry. So I will choose these points according to the how it works. So acupoints near the pain area, acupoints near the meridian line, and the special points, I would like to mention just two of it. So the one that have been used successfully and very useful, this one is the Telco. So the one on the leg, ST38, and I use this to treat the problems with shoulder, especially frozen shoulder. So it's very effective, just one needle, and asking the patients to move and repeat. And Tai Chong on the foot, I use that to treat migraine headache, and can be very effective. So these are two very good examples where the treatment of points is far away from the. So acupuncture is famous for managing pain. So how does it work? So the first way is through nerve or neurotransmitter, where acupuncture stimulates the release of endorphins, and also locally it can stimulate the nitrogen oxidase synthase, where it helps the problems, the inflammations on the pain regionally. And also it can reduce sweating by promoting circulations and increase blood flow. As for acupuncture's theory, how this works, because Qi is actually controlling the commander of the blood. So by having the Qi manipulated, it can control how the blood flow is being, and also can also lessen the damage, can stimulate the healing due to the blood flow, improve blood. And acupuncture has the additional calming effect, can soothe the emotion on it, and also at the same time it can improve sleep quality. So by having a better sleep, that can improve addiction. So, and also in stroke rate, I will here talking about the main famous use of acupuncture, pain and stroke. So how does it help? Can improve the balance function, spasticity, like flexibility of the body, increase the muscle strength and tone. So on these three functions, they actually can help patients to exercise better. Because in my opinion, acupuncture helps stroke patients exercise in physiotherapy, other therapies, improve on their movement of it. So this is how acupuncture works. And also it helps the general well-being, stroke, sleep quality, constipation. Acupuncture helps very well with it, and the pain management. So I will talk a bit on a couple of case studies just to illustrate pain and as well as stroke. So the first one is pain. So female came in, left knee pain. So I started with the first session, putting acupoints surrounding the left knee, but it didn't relieve that well. She also received painkiller jabs, but it's not really relief as well. So on the second session, I came in and I did some further examinations. There were pain in the muscle nodes on the part of the back. And that time is about thoracic vertebra 9. So what I did is I just put acupoints on the back and buttock area. So there's just in this point, I used a similar to the first session. There's no more points on the back. And I did some cupping because cupping helps the wind, Chinese word, wind and the humidity. So just to add on to it. And after the third session, she never came back because she has reported through the phone, she has relief through the. So this is one of the very good example of how acupuncture not only putting the needles around the so along the back that can help with it. And as with the stroke, so as is this actual case. So he has a stroke about 1 month ago. Even despite having physiotherapy, unable to limbs. The movement range for hand is about 0, and the leg is 1 or even less. So he has been having physiotherapy 3 times a week. So acupuncture will call him to see where they can. So he had it twice a week. So I put the needles along the limbs and also the back. So as the limbs, of course, is to help, and in the back is to help the core strength, the back strength to help him stand up, sit, stand up. So the improvement is quite encouraging because by second week, by 2 weeks, he's able to start bending his leg up, and able to stand with help, and he can sit by his own backside, which is, it means a lot because it means he can sit and have his meal very well. So by 1 month, he's able to walk with assistance. By the second month, he can move the arms a little bit with support, not as well. It's a bit less on it, but the movement, it shows something that the improvement is there. However, for the patient, he stopped acupuncture treatment by 30th session, which is 4 months later. So he wanted to try other alternative treatment. So, but by then, he's able to stand and walk with assistance, and his hands and arm has improved. Okay, so it's actually able. I mean, even though he has stopped, glad that acupuncture able to leave him in a better state than before. So, as the time goes by, it come to a conclusion. So, as in the conclusion, acupuncture, at least in my experience and also in clinical trials, it's proven to be effective to treat the pain and stroke. And it also works well with other types of treatment, like drug therapy, physiotherapy. In fact, in certain cases, some of my patients have feedback that after acupuncture, they're able to reduce the usage, their dependence on the painkillers on it. So, for stroke, actually needs physiotherapy, needs exercise. So, in the future, what I'm thinking about is I would like to explore for the not only pain and stroke, how acupuncture can be integrated in the healthcare system, and because it's affordable, it's a very effective treatment. So thank you. Okay. Thank you very much for the talk, for listening.